I'm Dr. J. Wiley with Focus MD. We're often asked this time of year about continuing ADHD medication during the summer. And this is the story that I always tell. Think of last summer when you were at the pool with your child. You have to remind them 8 times to get out of the pool. Get out of the pool. Get out of the pool. We've got to leave. Get out of the pool. And the frustration that ensues with that. Not just getting them out of the pool, but there are the steps that you have to go through to get in the car to go home. Once your child is out of the pool, he has to find his towel. He doesn't know where the towel is, so you wind up finding it for him. And as you turn around to look inside your bag and pack up completely, you find that you turn around to find him shivering and holding the towel but not drying off. So you have to remind him to dry off. The next step is walking to the car, and as you turn around you realize that he doesn't have his flip-flops. Where are your flip-flops? He doesn't know where the flip-flops are, so you help him find those. Finally, you begin walking toward the car, and at each step along the way you have to remind him to be sure he has his towel, to be sure the gate latches behind you as you leave the pool, and then finally to get in the car, and then a reminder to buckle the seatbelt. Unmedicated children have a lot of trouble with this sequencing through a series of events, and then completing the task with the buckling of the seatbelt. Come August, the teacher's going to give him a homework assignment, and she's going to tell him to write it down. He's got to find a piece of paper, write it down on the paper, put the paper in a folder, and put the folder in a book bag. He's got to remember to get the science book that pertains to the assignment, get that in the book bag, bring the book bag home, remember to open it, remember to check the assignment, do the assignment, and then remember to put it all back in the book bag and put the book bag by the front door so it goes back to school with it. Initiating and sequencing through a series of steps. Kids that stay on medicine year-round do a better job with what psychologists call executive function. It's basically being able to run their own affairs more independently and with more maturity. So yes, we recommend that those trips to the pool will be much, much simpler and much more enjoyable for the child who's paying attention. Keep the medicine going during the summer. If you think your child needs a vacation from his medicine, he's not on the right medicine. The medicine should not be blunting him, seriously affecting his appetite or personality, and that's why we work for dose optimization here at Focus MD.